Real-world access, yes, I think right now that is definitely a huge interest for the field. Now that we finally have 2 regulatory-approved CD19 CAR Ts, how is that performing in real-world practice? And at ASH in December 2018, we heard reports from 2 different groups, a 17-center consortium that reported their outcome, for which Mayo Clinic was one of the center as well. With that group, they reported outcome for 165 patients dosed with Yescarta. There was also another 8-center group that reported their outcome for 76 patients treated. What's interesting is in the real-world practice, what we're seeing now is about half of those patients would have some features, whether that's performance status or organ functions or other aspects of the patient that would have made them not eligible for treatment through the pivotal trial. And so really important to learn if the outcome might be different than in that situation. Granted, the follow-up is still short in real-world practice. At the time of the report, these are average of multiple months, not a year or longer. But so far, what we've seen is, despite some, having close to half of these patients outside of the trial criteria, we're still seeing a 97% manufacturing success rate to make CAR Ts out of their cells, and that's a very important, first feasibility question. The next thing that's interesting to note is that so far what we've seen appears to be very comparable side effects in terms of cytokine release syndrome, neurotoxicity, as well as clinical response. It's also interesting that there's a subgroup analysis looking at older versus younger patient populations, so patients who are older than 65 versus those who are younger. And again, we did not appear to be any statistically significant differences in terms of this severity of cytokine release syndrome and neurotoxicity, and the response rate is also comparable in this group. So I think, as we treat more patients in real-world practice and follow them for a longer period of time, we will learn if potentially more types of patient could be eligible and benefit from this treatment modality.